Alright, I'm Carrie. I'm going to be your student nurse practitioner today. I'm going to start with a neuro exam. At this point, I'd be checking his GCS, which would be a 15. We would check for alert, appropriate speech, behavior. And then we would move into cranial nerve 1, which is your olfactory. If you can close your eyes. Any trouble breathing on either side of your nair?
No.
Perfect. Keep your eyes closed. I'm going to put a smell. Can you smell this?
Yep.
Can you smell this?
Yep.
Perfect. We'll move into cranial nerve 2, which is the optic nerve. This is looking at the optic disc, which we've already performed this exam in the HENT exam. We would just be checking for size, arteries versus veins. We would do the Snelling eye chart, which we have done. We would do the movements of the eyes, and then we would move on to cranial nerve 3 and 4 and 6. These are oculomotor, trochlear, and abducens, checking the movements of the eyes. At this one, we would check pupil size, which we have already done in the past, convergence and accommodations, which should be to 5 to 8. And then again, we would check EOMs on the 6 sides, checking lateral movement, making their symmetry. We would make sure there's no ptosis or drooping of the eye, which would lead to a rule out of myasthenia gravis. We would then move on to cranial nerve 5, which is the trigeminal nerve. I'm going to have you close your eyes. We're going to have a soft side and a sharp side. Soft, sharp, okay?
Mm-hmm.
This is soft or sharp?
Soft.
Soft or sharp?
Sharp.
Soft or sharp?
Sharp.
Soft or sharp?
Soft.
Soft or sharp?
Soft.
Soft or sharp?
Sharp.
Perfect. Keep your eyes closed. Can you feel this?
Yes.
And this?
Yes.
And this?
Yes.
And this?
Yes.
Perfect. While your eyes are closed, can you raise your eyebrows up and wrinkling your forehead? Perfect. Everything looks symmetrical. There's no change in either side with sensation or movement. At this time, I'm going to grab your mandible. I'm just going to move it to the side. Push against me. Other side, push against. Down and push against. Fit. Bite normally.
Mm-hmm.
Any troubles with that?
Nope.
Perfect. We will now move on to cranial nerve 7, which is your facial nerve. Excuse me. Can you give me one big smile? And we're just checking for symmetry. Wrinkle your forehead again, please. Puff your cheeks out. Perfect. Has good strength and symmetry. We're going to move on to cranial nerve 8, which is the acoustic. We would normally be checking the Weber and a Rhine, ruling out air versus bone conductivity. We have performed this test prior. Excuse me. We will move on to cranial nerve 9, which is the glossopharyngeal. At this point, we would have the patient test the patient's gag reflex, letting them know, just for kindness, we'll not perform that today. We'll move on to cranial nerve 10, which is the vagus nerve. And 9 and 10 are both sensory and motor nerves. I'm just going to sit in front of you. You open your mouth. Everything looks in line and midline. Can you say ah? It moves. It has a curtain-like appearance in the closure. You can breathe normally. There's normal. You open one more. Rise and fall of the soft palate. And are you able to swallow?
Yep.
Give me one normal swallow. Perfect. Cranial nerve 11, which is your spinal accessory nerve. I'm going to have you lift against me, your shoulders. Perfect. Push against me and push against me. These check our sternocleidomastoid and the tops of our traps. And again, movement is equal in strength. It's +5. There's no change from one side to the other side. It's symmetrical. Oftentimes just ruling out any asymmetry along the way. We'll next move into cranial nerve 10, which is the hypoglossal nerve. Again, I'm going to have you open your mouth. I'm going to have you stick your tongue out and move it from side to side. On the other side, perfect. There's no fasciculations. It is midline. There's no trouble with articulating words or speech. And then we are going to move on to our muscles, where we use a grading system of 1 through 5. 5 is normal, where we would like its movement against gravity with resistance. 4 is movement against gravity with little resistance. 3 is movement with gravity eliminated. And 2 is continued movement. And 1 is just a flicker or a trace of movement. I'm gonna have you squeeze my hands and then pull, resist me, pull in, push out. Perfect. You can relax. And I'm just gonna resist me on this side, resist me on this side. Perfect. Then I'm going to have you lay back. As you're there, I'm just gonna have you raise your arms, lateral raise. Any troubles there?
No.
Keep them there for a sec. Just press down. Okay, you can relax. We're also checking our muscles for atrophy, their size, if there's any breakdown, if there's any tremors, if there's any tics, any involuntary movements, the bulk, and if there is any abnormalities. Are they the same? Are they unilateral or bilateral? And in motor, there's 4 functions: the cerebellar, the vestibular, and the sensory. And so I'm just going to check your legs real quick. Can you lift against me? Perfect. And against me? Perfect. Same thing. Push out against me, push against me, and against me. Perfect. We have equal strength. It's +5. There's no differences from one side to the other. There's no notification of atrophy, any unique bulkiness. Next, you can go ahead and sit back up. I'm going to have you stand and just have you walk just to the corner and back. Normal walking. Perfect. Arms are swinging. No issues with balance. It's steady. It's smooth. You can go ahead and stand. I'm going to have you do a walk with a heel to toe walk. We're able to have balance, which is intact cerebellar functional. We have motor. Come on back. Perfect. You can have a seat. And while you're sitting there, I'm going to have you put your hands on your thighs. Just want you to alternate them. We have smooth, rapid movement. You can relax. I'm going to have you tap your palms of your feet on my hands. Perfect. Equal, rapid, smooth movement. You can relax. And then I'm going to have you take your fingers and do fingers. We have quick movement. It's rapid. It's smooth. It's not jerking. You can relax. Thank you. Next, we will. I'm going to have you put your. You're going to have your finger from your nose to my finger. Does that make sense?
From here
to here.
to there.
Yeah. Again. And again. Perfect. I'm going to have you close. You're going to keep your eyes open. Reach your arm out. Like that. Yeah. Thanks. There's my finger. You raise your arm up and down. Back to my finger. Again. And then I'm going to have you close your eyes and do the same thing. Perfect. You can relax. After that, I'm going to have you, can you run the heel of this one down the front of this leg? And the same on the other side? Perfect. Again, all around equal movements, no changes one side to the other side. They're smooth, there's no jerking. Now at this time, I'm going to have you go ahead and stand up. And have you pick up one leg and balance. Okay, I'm going to close your eyes with that leg still up, please. And again on the other side. Eyes open. Balance, not close. 20-30 seconds we would check balance. You can go ahead and sit back down. Thank you. We were able to balance with the eyes closed. And then I'm going to have you put both arms out, palms up, and then I'm going to have you close your eyes. We would normally wait 20 to 30 seconds looking for any pronate or drift out to the side, which can be indicative in strokes, any sort of abnormal brain injury. You can go ahead and relax. Alright, next we will start with reflexes. A +2 is a normal reflex, and a +4 is hyperactive with a clonus, and 3 is brisk, and 1 is little to no reflex. So I'm going to start with the upper extremities. I'm going to be right out in front of you. And put one finger on the bicep. Go ahead and relax your arm on your hand. Perfect. And we can feel contraction in the bicep. And go ahead and hit the tricep area. And the elbow should extend. Then go ahead and relax your hand all the way on. I'm going to go ahead and hit the radial. And we should see a flexion of that. And we can go from side to side so that you can notice any differences from one side to another. Okay, go ahead and relax back. I'm going to check a patellar reflex. You're going to lay back. I'm just going to lift your leg up here, okay? Go ahead and relax as best you can. You should see a slight extension going out. Same on this side. Slight extension going out. Perfect. +2 reflexes on those. You go ahead and sit up. We're going to have you cross your legs. And I'm just going to test the back of your ankle here. Go ahead and I can hold your leg. You relax. And we're just going to tap posterior. Perfect. And then the other side. I'll just hold it. You relax. Perfect. All reflexes are +2 reflexes are watch the neural pathway up to the brain, and then the message comes back down that same neural pathway, creating the reflex or the movement. Next we will do, actually I will do a Babinski's while we're here. If you can lay back. I'm going to hold your foot here. You can relax. You're going to feel the Babinski's. The feet should not fan out unless they were a baby. Once you get older, you lose that. They should turn downward. Good. Other leg. Up. Perfect. All right. From there, go ahead and relax for a second. We're going to go into, I'm going to have you close your eyes. And I'm going to ask you if there's 1 or 2 points, okay? Is there 2 points or 1 point?
2.
2 or 1?
2.
2 or 1?
1.
Perfect. Probably about 5 centimeters apart. You shouldn't be able to distinguish between the 2 points. Over here, 1 or 2?
1.
1 or 2?
2.
And 1 or 2?
1.
Up here?
1.
Okay. And here?
2.
Perfect. And we would just make sure that we would go down both legs, comparing each side to each other. Next, we will, I'm going to use a vibrating fork, the 250 or 158, it would be okay. I'm going to vibrate it. You're going to feel it on your finger. You can tell me when it stops.
Stops.
Do you still feel it up here?
Yep.
Okay. And again, we compare one side to the other side. You feel it?
Yep.
Tell me when it stops. Can you still feel it up here?
Yes.
It is normal to feel it longer, closer to the trunk of the body. That would be expected. Next, we would do, excuse me. If you, I'm just gonna grab your leg here. I want you to close your eyes
Mm-hmm.
and tell me which position is your big toe, downward or upward.
Down. Up. Left. Right.
Okay, and relax that one. Your other foot, same thing, eyes closed.
Mm-hmm. Up. Down. Left. Right.
Perfect. Keep your eyes closed. Can I see your hand?
Mm-hmm.
Is this down or up?
That's up. That's down. That's left.
Okay. Other side, same thing.
Down. Up.
Perfect. Next, we're going to do stereogenesis. I'm going to put an object in your hand and you're going to let me know if you can identify what it is. Keep your eyes closed.
Mm-hmm.
Can you feel that?
We can.
Are you able to identify?
It's a quarter.
Perfect. On the other side?
It's a quarter.
Okay. Thank you. The next we are going to do, keep your eyes closed. I'm going to put a number. I'm going to see your hand. In your hand, this is the graph. I can never say it. Graphesthesia. What number?
2.
Okay.
2.
All right. That's perfect. I'm going to have you lay back. If you can just scoot up a little bit further. Okay. I'm going to lift your head up. You can just relax.
Mm-hmm.
And this is checking for kernings. We don't see any raise in the legs when we lift the back side of the neck. And then I'm going to extend. We'll do a straight leg. Does this bother you at all?
No.
No? Good. And then I'm going to bend the leg in and bring it in and see if that causes him to raise his neck at all. Any movement in the neck or head?
No.
That's a Brudzinski's. Those often will be positive when you have an inflammation of the meningeals, like meningitis. And this side, anything?
No.
No raise? And any pain in the back?
No.
I'm going to go ahead and just do sensation on some of your feet and legs. Just because I didn't get a chance to. Is it okay if I roll these up?
Sure.
Alright. You tell me if it's sharp or dull.
Okay.
This is what sharp will feel like. This is dull.
Sharp. Sharp. Dull. Dull.
And again on this side, same thing.
Sharp. Sharp. Dull. Dull.
Okay. When I move to your arms, we'll do the same thing on those. We compare side to side to make sure the sensation is the same. We make sure there's no powdering, the gloving powdering to rule out peripheral neuropathy, often from diabetes. Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Sharp or dull?
Dull.
Sharp or dull?
Sharp.
Perfect. And from there, I believe that is it.